protects TSET and also, make sure that we're fulfilling the goals that we've written into the grant application, is that we have to pay for the meals up front. We have to front the costs to perform this program, and then after reporting's done, we'll get reimbursed by TSET.
How often do you verify that the meals are reaching out the most vulnerable students, especially in rural or under-resourced districts?
Well, all of our school pantries that we already work with, we've been doing this for many, many years with multiple school pantries, not with the fresh meals like this is going to provide, but from a shelf-stable standpoint. And those pantries have been target the most vulnerable, and the schools know that information. We don't particularly need to know what students and who they are. We allow the school district to identify the families that are the most vulnerable that can access the school pantries and get access to these fresh, nutritious meals.
Great. Will the public have access to regular progressive reports or data showing whether the program is hitting its goals?
Yeah, I'm sure that from just a transparency standpoint, being transparent, I'm sure that we will share that kind of information and that kind of data as we go throughout the process. I have complete confidence in our team and the goal and the mission behind what this is going to accomplish, that this is going to make national news. And in order for it to do that, we're going to be very transparent and show the outcomes of this. I've lost my words.
Is that national news? I would say a national model.
Huh?
I would say this would be a national model.
Okay.
You want to repeat the question?
Yeah, ask it again if you don't mind.
Will the public have access to regular progress reports or data showing whether the program is hitting its goals?
Yeah. So to answer that question, I would say yes. I think that we'll be very transparent in providing that data to the public on a regular to show the goals that we're achieving, but also the impact of telling the story of all the great work that we're doing. The whole initiative behind the mission of this program is to feed the most vulnerable children a healthy, nutritious meal on the weekends when school's not in session. And so from making this, a national model, a trendsetter here in Tulsa, Oklahoma, we want to provide that kind of data and show all the great work that we're achieving.
Right. So what safeguards are in place to ensure no school is excluded because of staffing, transportation, or just other logical gaps?
Yeah, so, as we go through this process, we'll identify the schools that have the capacity, have the capabilities of being able to perform and meet the guidelines that they have to make sure that they are able to be part of this grant application.
How will you monitor academic improvement tied to nutrition, and which districts are participating in that data collection?
Yeah, so we have this has been a pilot program with 20 different schools that we've already identified, and just getting test scores. We obviously, from knowing the child individually and their name and who they are, this will be data that we ask that the school would provide to us. And so we are confident that as the children access these healthy, nutritious meals over time, we will see the improvement, and the school will be able to report back that this child started at this level of academics, and now they're here at this level, and hopefully also see their health improve as well.
How will you track the quality and consistency of the meals across all participating schools?
Well, since we're the ones making the meals here, we're going to make sure the quality is top notch, right? Somebody that's a chef that for 26 years, that was my background. We won't serve anything out of this facility if it's not of quality to meet the standards of anybody eating the meal, not just the most vulnerable.
What happens to participating schools if the expansion grows faster than expected? Is there
You know, I'm sure that if this keeps expanding and growing, that's a good thing that shows that it's working, right? And that we are truly fulfilling the mission of this grant. And I'm sure that what I love about Oklahoma is the better together. We just saw it in the SNAP response, as that community comes together. And if we can show, and again, going back to the question of the transparency of achieving the goals of this grant application, I feel like when we can show that, and it expands far beyond what the application was written for, the community will get behind it, and we'll be able to support it in whatever capacity it grows to.
So, TSET's funding comes from tobacco settlement dollars. What does it mean symbolically and practically that the money is tied to tobacco that harms is now feeding children?
Yeah, you know, I mean, that this whole feeding Oklahoma, and we're feeding hope. I'm sorry, not feeding Oklahoma. We're feeding hope, but also feeding the future, right? And this whole thing is healthy, nutritious meals, and so getting people into a healthier lifestyle and habits. And tobacco is not a good habit to have, right? And so TSET has worked years to drive that data down that shows especially young adults getting into tobacco, and they've done a really good job with investing in their dollars. Now they're wanting to improve in the health of these kids and the future of Oklahoma, and so creating healthier lifestyle choices like healthy food items, introducing them to new food items that they might not have known about. So it means a lot that a tobacco settlement endowment trust is looking innovative and thinking outside the box through healthy initiatives with food, just like that Feeding Hope is providing.
So, how do you assure these programs don't become
Feeding Oklahoma. I keep saying Feeding Hope. Feed Oklahoma. Feed Oklahoma. Don't Feeding Hope. Feed Oklahoma.
How do you ensure these programs don't become dependent on settlement revenue, which can be unpredictable year to year?
Yeah, well, it's just like we've been around for 44 years and started out with 2 employees, and now we're at 92 employees, 170,000 square foot facility. We've showed impact and growth, and that we're moving the needle. And so I feel like naturally with 3 years of this that we're going to be able to achieve the goals, and we're going to find community donors, public dollars, people that want to get behind this and continue to feeding Oklahoma, right, and feeding the future through this legacy grant. But then also we'll have the opportunity to go through another grant application with TSET, and if I feel confident that if we destroy and we accomplish and just knock it out of the park, our goals, that TSET would be interested in continuing to fund this as well in some sort of fashion.
What message do you think it sends to the public that revenue once tied to tobacco harms is now used to support healthy food access?
I think that sends a great message that every state, I don't know what year it was, but it was multiple years ago that there was this big lawsuit, and every state got TSET dollars, right? And so a lot of states invested it differently. Oklahoma is one of the very few, I think there were 6 or 7 that made an endowment, a trust with it. And so the fact that we did that, Oklahoma did that, and in thinking long term in the future and the healthiness of their state through education of tobacco, but then also education of healthy choices like food. That speaks a lot to TSET and what they're doing in the public, but then how Oklahoma many years ago thought about the future with how they invested those dollars.
So, how does TSET evaluate whether the nutritional programs funded through settlement dollars actually improve the long-term health outcomes?
Yeah, I mean, you know, there's data that shows that there's less and less people purchasing tobacco these days. Um, you know, it seemed like every 10 years ago, even everybody had a pack of cigarettes and smoking cigarettes on the side of the street. I hardly ever see anybody smoking cigarettes anymore. And so, right there, the proof's in the pudding, right there. But then also now, how they're shifting their approach, still educating on not to use tobacco, but they're shifting their approach in innovative ways like food access, healthy, nutritious food access, and getting kids that are the most vulnerable to make healthier choices, but also educating them about the choices that they can make. I feel like it speaks volume.
So, I guess for my last question, how does using settlement money for child nutrition fit into TSET's long-term vision for improving Oklahoma's overall health rankings?
Yeah, you know, TSET has always been wanting to invest in the future of Oklahoma. They're thinking long term, and that's, do they want to change the outcome of seniors and adults? Sure, but also if they can change the outcome of the future of Oklahoma, the future leaders, then that's ultimately going to change and take us from 49th in the state of education down to 25. You know, make that a goal, all the way down to the top 10. But then also in health, is you got to change generations. And that's what TSET is doing. They're thinking long term. They're thinking kind of like the book Good to Great with Jim Collins. They want to get great. We just don't want to be good. We want to be great. But it takes time, and it takes a long-term vision. And that's what we're seeing now, is them investing long-term into Oklahoma's future.
Is there anything that maybe I didn't cover at all that you'd like to?
Man, you covered a lot, bro. You covered a lot. I'm looking back. I'm like, where did you get these questions from? No.
The